The World Health Organization says more than 6,000 Jamaicans died of cancer in 2020. More than 1,000 of them could have been because of inherited genes. Obstetrician gynecologist Dr. Sean Parkinson says inherited cancers can be prevented, and he's urging his colleagues to be more vigilant with patients who are at risk.
Depending on which cancer we're talking about. So for instance, breasts, about 5% of breast cancers are due to abnormal genes. So this may run in the family. So how we're able to detect this is whenever we're seeing patients, as a standard part of the history taking is to ask about their family history and the family history of certain cancers. Because not all these cancers are inherited. So specifically breast cancer, colon cancer, ovarian cancer, pancreatic cancer, and cancer of the lining of the uterus or the endometrium, among some others, including prostate, may be inherited. So when we take this history from our patients, they may tell us of a relative who may have one of these cancers. Now, if this relative develops this cancer in the 70s or 80s, it makes it unlikely that it's an inherited cancer, but especially when you're finding a number of family members with one of the aforementioned cancers at a young age, or multiple family members with any of these cancers, then you want to think of investigating that patient for a possibly hereditary cancer.
Dr. Parkinson wants more public education about preventing these types of cancers.
People are generally not aware. The myth out there, you only get cancer when you're old, until we're seeing these younger cancers now. And, smoking, alcohol abuse, the obesity epidemic that we're facing now definitely contributes to developing cancers. But as I said, these are sporadic cancers, and we know that these factors contribute. But the hereditary cancers will account for a significant proportion of cancers that we're seeing in young people. So people would be alarmed. This person is 25. How is it that they have breast cancer? So what we want to do now is to act rather than react. So when we're seeing these young cancers, we want to improve the awareness to say, first of all, the onus is on the doctors. Spend some more time with the patients. Take a more detailed history. We were taught in medical school that blueprint, family history, it's significant. So get into details to see if there's any cancer that runs in the family, what age, the type of cancer, and refer appropriately to the medical oncologists and the other specialists that can test for these inherited cancers.
You can hear more from Dr. Parkinson on the next episode of PBCJ's Blueprints to Health.